Well, good afternoon. We've been working hard to get people back to work, to get more people back on the job, safely and gradually. And today, we called back the House to pass important legislation as we continue to reopen the economy. I want to thank all the parties for their support and cooperation. Today, we'll be asking the House to extend the declaration of the emergency order until June the 2nd. This extension will also continue enforcing important public health measures. And while we've made significant progress, we still have a long way to go. But we also have many reasons to be hopeful. We're making steady progress. On Sunday, we saw the lowest daily number of new cases since March 31st. Our hospitals have added over 5,000 acute care beds. We're continuing to ramp up testing. If we stay the course, we will soon be ready to take the next step. And now is the time to prepare. We're talking to our business owners and job creators. Their input is helping us inform our next steps and the barriers we need to remove to ensure they can succeed in this new environment. We now have over 80 workplace safety guidelines to help our employers keep their staff and customers safe. We're building a solid foundation for the cautious reopening of our province. We're charting a path to a strong recovery. With the progress we've made, I'm confident we can move forward. On Thursday, we will share more good news. More good news about getting people back to work, more good news about opening workplaces, getting paychecks out the door, more good news about slowly getting back to normal. On Thursday, we will share more details about the next stage of reopening our province. We'll be reopening more low-risk workplaces, seasonal businesses, and essential services. We can get more people back to work. We have been through a lot these past few weeks. We have sacrificed so much. We've lost loved ones in this fight, but we remain resilient and unbreakable. And this has made us stronger, more united than ever before. Together, we'll face our future. We will rebuild what we have lost and more. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Phillips.
Thank you, Premier. Throughout COVID-19, Premier Ford has talked about the Ontario spirit. It's the Ontario spirit that drives our healthcare heroes to provide outstanding care amidst a global pandemic. It's the Ontario spirit that inspires the small business owner to retool their operations to produce essential medical supplies. And it's the Ontario spirit that motivates community volunteers to check in by phone with seniors in their community. Our province sees the light at the end of the tunnel because regular people are stepping up and making a difference. And as the Premier says, all of the credit goes to them. We are going to trust the people of Ontario to continue to listen to the advice of our health and science professionals to make the reopening phase a success. We are listening to the people, employees, employers, unions, and not-for-profits about the unique impacts and needs of their regions and their sectors as a result of this global pandemic. Their feedback will inform how to reopen the province to ensure people can thrive and businesses are stronger than ever. Many people have already visited ontario.ca/reopen to provide their input. The online survey seeks feedback on the impacts of COVID-19 on personal finances, business supports, and government relief measures. We've asked MPPs in all parties to hold local consultations in their ridings so we can hear from people across the province. Now is not the time for partisan politics. This builds on the discussions ministers are having with representatives from every sector in the province about their unique needs amidst COVID-19. We know that many of these are practical concerns. What level of cleaning is required for their business? How to set up a business for physical distancing, and all of the nuances of PPE. These may seem like minor details, but as someone who has run a business, I can assure you these are details that matter. And these details are essential for our public health. The more than 80 workplace safety guidelines the Premier mentioned that we've released will help. In fact, the real-life experience of essential businesses who've operated through the pandemic have fed into this process. We know the reopening phase is close. So we're preparing by listening to the questions, concerns, and ideas of the people of Ontario and making sure that they inform our plan. Because we are seeing positive signs. And when it's time to reopen, we want to succeed together. Thank you.
We'll go to the phone line for questions. Just a reminder, one question, one follow-up. First question, please.
Your first question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. It's nice to be first. I just want to say that's quite the beard that Paul Calandra has there. I wanted to ask about public health. I think the last time I asked about this was a couple of months ago before we got really into the thick of this, and I was asking about the public health cuts in the 2019 budget. And your answer was that you were going to take them year by year. So where are you on that now? Is that changing?
Well, I'll pass that over to the Finance Minister. He'll be taking care of that. Thank you.
Thank you for the question. Ferg, as you know, as you'll recall, we suspended the discussions around restructuring in public health and then added $160 million in the March 25th financial statement to support public health. That came in a variety of forms, direct support for our public health professionals. It also talked about the expansion of things like our telehealth programs that have since been expanded even beyond that. So there's been a significant investment since the March 25th announcement in public health. We'll continue to make sure that those frontline professionals have the resources they need. They're so essential for items like our contact tracking programs and our testing programs.
Okay, thanks for that, Rod. And just if I can get Christine Elliott up there, please. Minister, today you were asked about the sample the testing of COVID-19 samples, and it was down to 12,000, just under 12,000 tests processed Monday. This seems to be a problem, like you mentioned, that happens every week. Why can you guys not solve this problem of getting samples to the labs to take full advantage of the testing capacity? Because there are, yesterday, for example, there are like about 8,000 tests that couldn't be processed. And that's a lot of information that you could be relying on.
Well, we need to continue with the high levels of testing that we're doing, and you're right, this does happen on a weekly basis, but that is really because of a transportation problem that exists on the weekends that is just not physically possible to move some of the samples from the test sites to the labs. So as our economy opens up more, hopefully we will have more transportation opportunities and we will be able to deal with that so that we don't have that one-day delay. But we are getting our test volumes up high, and we know that we need to continue testing as we start to open up the economy. That's going to be very, very important to understand if there are any impacts as a result of the changes that we're making and opening up. So we need to keep the number of tests high on a daily basis.
Next question.
Your next question comes from Travis Daharaj with Global News. Please go ahead.
Hi there, Premier.
Hi,
Good
Travis.
afternoon. So I know in the legislature you were asked a couple times about a public inquiry, and Jill Andrews talked about a very emotional story about one woman who had to sit next to her mother's dead body overnight at Megan Manor because there weren't enough staff there. So I'm just wondering, for a family like that, or for families who have relatives in long-term care that are wondering why you won't commit to a public inquiry, why you're just committing to a review, what would you tell them?
Well, we're going to do a complete review of long-term care, and Travis, as we move forward, we're improving the systems as we go, but we have a lot of improvement still to do. And we inherited quite a mess, and I'm not going to blame the previous government. This has been going on for decades, but it's a system that we're going to need help from the federal government to get the proper funding in there. And, you know, I've always said 2% of the people in long-term care out of 78,000 patients have been infected. And in my opinion, that's 2% way too many. We shouldn't have any infections, and we're going to do everything we can. We'll not spare a penny to make sure we correct the problem in the 176 homes that are infected out of the 626. It's a system that's broken. Are we making improvements every single day? Absolutely, we're making improvements. Are we learning a tremendous amount through this crisis and this pandemic? Absolutely, we are. And we're going to make sure we make the appropriate changes. And we look forward to the support of the opposition parties in supporting us, because we all play a role in working together and getting this resolved.
Next question is for the Finance Minister. I'm just wondering, I know the Premier teased a big announcement coming on Thursday, which is likely going to be very good for businesses, more reopening. But do you have an estimate, a figure on how much revenue the province has lost as a result of the virus thus far?
Well, Travis, in the statement, and you'll recall that unique among Ontario governments, we did bring forward a statement that reflected at that time our view of the impacts of COVID-19. So on March 25th, we brought forward a statement that indicated about a $6 billion impact at that time. Obviously, the situation has evolved and continues to evolve. One of the things that we did put into this year's one-year financial plan was a $2.5 billion contingency, and that's because we knew that there could be further challenges as the situation evolved. I will provide updates, as you know that I do, each quarter. I think the next one's going to be in August, where we'll make sure that for the media and for the people of Ontario, we're transparent about the status of the province's finances. And we've also said that we will have a full budget by November 15th. At that time, we're hopeful that we'll be able to look at the full picture. Right now, we're in the midst of this global health crisis and, of course, the economic crisis that followed. So we're hopeful that by the time of that November 15th budget, we'll be able to bring forward new numbers that reflect the impacts of this global crisis.
Next question.
Your next question comes from Mike Crawley with CBC News. Please go ahead.
Yes, hi. My first question is for the Premier. Premier, SARS killed 44 people in Ontario, and there was a public inquiry. Elizabeth Wettlaufer killed 8 people in long-term care homes. There was a public inquiry. At Walkerton, 6 people died. There was a public inquiry. At Ipperwash, the OPP killed 1 First Nations demonstrator. There was a public inquiry. So far, COVID-19 has killed nearly 1,800 people in Ontario. Why won't you commit to a public inquiry?
Well, what we want to do is make sure we get through this and support people in long-term care, and right across this province. We're going to have reviews right across the board, no matter if it's a procurement system or if it's long-term care. We'll make sure we review it from top to bottom.
My follow-up is for Health Minister Elliott. Minister Elliott, the Registered Nurses Association of Ontario is expressing concerns that long-term care homes, although they are eligible to become part of the Ontario health teams, that it's not a mandatory thing. And so they're suggesting that it be made mandatory that long-term care homes become part of the Ontario health teams to avoid the kind of things that have been happening during COVID-19. Are you willing to consider making it mandatory?
Well, in actual fact, most of the teams that have come forward already as local Ontario health teams do have long-term care included as part of their group, because we want to create the integrated care experience for people across the province of Ontario, so that they have excellent care, whether they're receiving home care, care in hospital, or care in a long-term care home. That is something that all regions understand. They also want to have public health involved, because we've seen how important public health is as part of this pandemic. So I don't think it's necessary to make it mandatory. It's just happening naturally.
Next question.
Your next question comes from Allison Jones with the Canadian Press. Please go ahead.
Hi, Allison.
Oh, hi. My question actually might also best be directed to Minister Elliott.
Yep.
It's about the pay premium that was announced in late April. Wondering why all hospital workers aren't included. QP is saying that it doesn't include maintenance workers, dietary technicians, and ward clerks, despite their very frontline roles.
Well, since we introduced the pandemic pay, we have heard from a number of organizations and individuals that were not included but have quite compelling reasons why they should be included. And so we're still listening to them. We're still understanding why they weren't included in the first place and are still looking to expand if necessary, because we want everyone who has been a frontline care provider to be recognized with this small token of financial assistance, but they deserve to be recognized for being at the bedside as well. So we are still listening, we are still hearing from people, and we're still considering other groups.
And the union also says that the government hasn't actually flowed this money to hospitals yet to increase workers' pay. Do you have a timeline yet for when that's going to happen?
Well, we have had several discussions with the Ontario Hospital Association as well as with some of the groups. So until we get things straightened out with respect to which workers in the hospitals are going to be receiving the pandemic pay, where the payments haven't been made yet, but they will be as soon as that's clarified. So those discussions continue on a daily basis, but we want to be able to proceed quickly with it once that's resolved.
Next question.
Your next question comes from Mark Douglas with 680 News. Please go ahead.
Hi, Mark.
Thank you. Question for Premier Ford regarding this big announcement coming up on Thursday for next reopening plan. Obviously, you don't want to mention dates right now. Could you give us an indication as to which sectors of the economy you may be focusing on? Who gets to open up next? And I'm wondering specifically if it's going to be restaurants and possibly just regular shopping.
Well, Mark, what I can tell you, we'll have more details on Thursday, and it will be stage one of 3 stages. So that's very important. That the people of Ontario have all followed the protocols, and we've hit stage 1 on Thursday. So we'll have more details as that rolls around.
Thank you. Premier, while you're there at the microphone, I'll put this question to you first. The official opposition released a memo today from Ministry of Children, Community and Social Services in which frontline workers at residential homes were told to start wearing cloth masks as opposed to proper PPE medical masks. Can you explain why such a memo would go out when you yourself have repeatedly said that all the PPE that frontline workers need is only a phone call to you away?
Mm-hmm. Well, I'll have that discussion with the minister and along with the chief medical officer. That's where we get our recommendations from the health table and the chief medical officer, but I will have that discussion with the minister, and I will stick with what I've always said. If people are dealing with COVID patients, they should be having the proper PPE.
Next question.
Your next question comes from Randy Rath with CHCH-TV. Please go ahead.
Hi, Premier.
Hi, Randy.
In your opening statement today, you were talking about businesses that want to open and that they should look at the guidelines that your government has put out for businesses reopening. Mm-hmm. The problem is these are only suggestions. There's no teeth to them. Shouldn't they be, regulations or statutes to better protect the public?
Randy, we want to make sure we actually went from 60 up to 80 areas of protocol that they should be following. We will have inspectors going into stores to make sure they inspect and they're following the proper processes to make sure not only their staff but their customers are safe as well. So we're going to continue with the inspections right across the board. And I have confidence in businesses. They're already getting ready to open up, and they're very responsible. Vast majority of businesses are doing everything they can to protect their staff and their customers. So it's the right thing to do.
As a follow-up, are you worried that because so many people have been out of work for so long that there's a desperation setting in, and that people would put themselves in jeopardy and not wear PPE when they would probably be better off wearing it just so that they can maintain or get employment?
Well, I think when you have an opportunity to wear it, you should wear it. And as one of the doctors mentioned on the health table, and if you can't get a hold of PPE, wear a scarf. It's better than not wearing anything at all, and it protects other people close by. But where you can, yeah, it's recommended, especially if you're going into stores and that.
Next question.
Your next question comes from Christina Elliott with CP24. Please go ahead.
Hi, Premier. Thanks
Hi,
for taking
Christina.
the time to answer my question. My question, I know you acknowledged that on Thursday you'll be making an announcement about workplaces reopening, but the province's emergency orders, including limiting gatherings to a total of 5 people, that order expires on May the 19th. So can we expect an easing on that order sometime soon, recognizing that, of course, you're looking to expand the province's state of emergency until June the 2nd?
Christina, we'll be having more to talk about on Thursday about that, and we're in full discussion with the Chief Medical Officer regarding the numbers, if we're going to move it from 5 to 10, but that will be the Chief Medical Officer's call.
And Premier, I know you've obviously made it clear that there is a need for a review of long-term care homes in the province, but retirement homes and group homes like Participation House have also, as you know, been hard hit, and those are congregate settings that are not included under the Ministry of Long-Term Care. As you know, they're included under the purview of 2 separate ministries. So what about group homes and retirement homes and a potential review?
Well, they're going to be under the review as well. We have a lot to review, and there's, as I've said, Christina, they've seen a lot of cracks in the ship, and sometimes that happens when the crisis hits us, that you realize where things can be improved, and they really stand out. And the people at Participation House, I just want to thank everyone that went in there to help out. They're great people, but anyone with congregate living, we will be doing a review from top to bottom.
Next question.
Your next question comes from Cynthia Mulligan with City TV. Please go ahead.
Cynthia.
Hi, Premier. So we're getting so much closer to opening up with stage 1. My question is, we still don't have a proper understanding of how widespread COVID-19 is in the community, people who never showed any symptoms at all. Why haven't we started random community testing so we can create a baseline, so we can see what the impact of opening up the economy would be?
Well, our number one priority right now, Cynthia, is to make sure that we get all long-term care residents and healthcare workers tested. And I said in the House today that hopefully it'll be early next week, but we're really shooting for the end of this week, and I have confidence that the health table will get that done. And then we're going to start continuing to work on anywhere that has congregate living, and then do the random testing. Cynthia, I agree. We need to do that random testing as well. So as soon as we work on the emergencies, and right now it's long-term care, we will make sure that we have the opportunity to randomly test, and also track and trace as well, which is important.
Okay. And I know you've got the big announcement on Thursday, but I have to mention we are getting so many emails from dog lovers who are begging for their dog groomers to be able to take in their pet. They say they wouldn't have any contact with them. And people in campgrounds with trailers, and they're wondering when they could possibly go to their trailer park. Can you give them any sense of optimism in these 2 areas?
Well, I can give them optimism. I just can't tell you until Thursday. But Cynthia, I've been getting the same calls about the campers and trailers, and what I'm hearing is, it's not fair. You're letting cottagers go up north, but as far as they're concerned, that is their cottage, the camper or the trailer. And some people, and what I understand as well, is the snowbirds come back and they're down in Florida for 6 months, then they go up north and be at a cottage or their trailer up north. So we'll have some positive news coming out very shortly on that, because it's about fairness, and we have to be fair to the people that own the trailers and the campers as well.
This will be the last question from the phone line.
Your final question comes from Omar Sachedina with CTV National News. Please go ahead.
Hi, Omar.
Premier Ford, good afternoon. We're hearing that there are enough testing kits in the system. So, especially as there's talk of a second wave, is it time to discuss the possibility of opening up the criteria so that everybody who wants to get tested can be tested?
Well, right now, even through the drive-through, I'll use Rexdale, my area, Etobicoke North, up by Humber College. You can drive through and get the test done. So as much as we are focusing on long-term care, you show symptoms, then I would highly recommend that you go get tested. And there's quite a few drive-through test facilities throughout the province, but I'd highly recommend getting tested.
Okay, and as a follow-up, I was just wondering if you could just answer whether there is a discussion about expanding their criteria. And I'm still struggling to understand, and so have many of our viewers, about why Ontario has not been able to hit capacity in terms of testing. I know you spoke about talking with the various public health units who are not stepping up. Minister Elliott just talked about transport issues, but here we are, almost 8 weeks in since the lockdown. Ontario's not hitting the capacity that it can test, and people are just wondering why that's not happening yet. I mean, the transport issues certainly can't be something that just popped up last weekend.
Yeah, no, I understand, Omar, and I'm pushing as much as I possibly can. I do appreciate the work Public Health and the Health Table are doing, but our target is 20,000. They came close the other day. But I also have to remind everyone, we're leading the country now in tests overall and per capita. We're going to continue on this pace. We're one of the leaders in testing globally, worldwide, per capita. But do you know what I believe, Omar? I don't believe in excuses. I believe in hitting the numbers. So we want to hit 20,000. You're right. We have everything that we need. We need to hit 20,000, and that's our target. Omar, I hear your frustration. I'm not disagreeing with you. We will get there.
Premier, this happened while you were in the middle of this. It looks like the CNE's been canceled this year. Your thoughts? I know you went there with your grandma.
Yeah, I went there for like all of us growing up. They didn't have a Wonderland when we grew up, and that was the highlight. I remember going to the CNE with $5, $10 in my hand, and you'd be there all day. That's going to be the first time I understand it's ever going to be closed. But these are some of the sacrifices that we're facing as a society, and I'm going to miss it. It's one of those things that you make sure you go every single year since I can ever remember. So it's really going to be missed, and especially the kids that have been going there for years. Especially our age group. The baby boomers, we all grew up there. We'd go down there, and those are the days that, remember, you'd be able to hop on the bus and go to the Dufferin Gates and get off with a bunch of friends. You didn't have to worry about anything. Your parents would let you go down there, and we had so much fun. We'd get there in the morning, we wouldn't come back till late at night, and again with $5 or $10 in your pocket. But what I loved? You remember those dollar spaghettis there? You used to have the dollar spaghettis or the double bubbles, and you used to be able to survive for quite some time. I think the spaghetti was 25 cents, and you'd be able to play the games and rides. Here I go reliving but it's something part of our culture here. It's part of our heritage, going back over 100 years. So I'm going to miss it.
Okay, thank you.
Okay, thanks so much, everyone.